This is Pete Moore on Halo Talks NYC. I have the pleasure of bringing straight out of Hermosa Beach from the oil and gas industry into the health tech market. Luke Hartelust coming from California. Good to see you, buddy. How you been?
Phenomenal, Pete. It's great to be here, mate. I'm looking forward to the conversation.
Excellent. So, you spent some time. Give us a little background on how you, kind of got to our Halo sector and how excited you are to be here.
Yeah, I mean, we can go way back if we want to highlight a bit of the journey. So, As a very, very long story, I'll try and keep it short so that we can get as much in as possible. But my career essentially started many moons ago when I was sitting on an oil rig, essentially 450 clicks off the west coast of Australia. Essentially pretty miserable, working 28 days on, 28 days off, kind of blistering heat, extremely dangerous conditions. And I had an epiphany one day, essentially, and I was standing on the middle of the drill floor, absolutely covered, head to toe in shit, for lack of a better term. 11 hours into a 12-hour shift, and it really kind of hit me, and that I needed to get off the rigs. And the way that I was going to do that was to start building companies, essentially. And at the time, I was 20. I was going to say I was 23, 24, and I was 11. I was making a couple of $100,000 a year, so I had the capital to start, essentially. But the problem was that I had no business experience, right? And so at that point, I decided I was essentially going to kind of build the man I needed to be to pursue this dream of being an entrepreneur. And it just so happened that at the time I was living in Thailand full time. So my 28 days off, I would spend time in Thailand. And I tell this story because it's a key component, and it's still to this day one of the most motivating places I've ever been in my life. It was one street, and it was lined with Muay Thai camps, kickboxing camps, boutique fitness gyms, CrossFit gyms, and bodybuilding gyms. And I saw an opportunity in the marketplace to take hot yoga to that area. And there was a lot of athletes, UFC athletes, Muay Thai athletes, high-level CrossFit athletes, coming from all over the world, and people that were on fitness holidays. So you had all walks of life there. And it was a missing piece to the marketplace. And so my first venture was obviously in a foreign country, which made that pretty difficult, and partnered with a couple of buddies. And we actually leased a block of land, and then built and designed and built the building, and then set up a beautiful studio. But long story short, that business failed, right? But I was still committed to kind of getting off these rigs and getting out of the oil and gas industry. And I knew this model of kind of entrepreneurship that I wanted to take was the ticket. So I looked into franchising. And in 2016, I relocated to the US to bring the F45 training franchise over to Southern California. At the time, there was one or two in the US only. And so we had the entire US market open to us. And I built and scaled a portfolio of training facilities between LA and San Diego, and consulted doing turnarounds for dozens more that were kind of underperforming over a 6-year period. And we exited that portfolio in 2022. And that, I would say, that journey essentially kind of honed my ability to develop systems and develop teams and lead with integrity. We made a ton of mistakes, but exposed me really what I wanted to do with my time, and how I wanted to spend my time in terms of, a blend of business and lifestyle.
When you take a look at the F45s, just, for historical purposes, what kind of revenue, were they doing, and what were you able to get them up to? Because from the FDD, I remember they were doing like $33,000 a month, and I thought that was way too low to run a sustainable,
Yeah, absolutely, mate. That's a great question, and it's actually something I've spoken about quite a bit with other franchise owners or other boutique fitness owners. And 30,000 was on average our payroll for each location.
Yeah.
And the way that we were doing on a good month, we would hit about 6 figures a month on a really good month. But our average would sit around about 75,000.
Okay, but that's a real business, yeah.
Yeah, and we did that very specifically through community initiatives, which is something that we found was really in this industry, as you know, is it's all community orientated, and we just found the right formula very, very early on in that sense, and we're able to make them quite successful. And we did really well for a couple of 27-year-olds that were coming to the US for the first time to try to chase a dream as well.
Mm-hmm. Just one more point on F45 before we move on. Obviously, that company went public. Fair amount of negative press around the business. How have you been able to kind of think about brand protection for MNLY and some of the things that you've learned that maybe you should and shouldn't do if you want to create a big company? Like, what are some of your takeaways from there, from looking at it from the outside?
Another great question, and I think the fall of F45, it just imploded from the inside essentially. Right. And to be completely transparent, we got a 6-year apprenticeship on what not to do when it comes to brand. And so when I look at what brand is today, in my opinion, it is the emotion that someone feels when they engage or interact with your product, your message, or your people. And so for MNLY specifically, we have had a core focus foundation on building brand over customer acquisition. And I can get into some strategies how we've done that, but making sure that we show up powerfully whenever we have an engagement, whether that's a strategic partnership, whether that's a community initiative, has been really key to the business. And to be honest with you, we've been on the market for 12 months, or just had our 13th month on the market. And it is one of the reasons why we've got such a strong core brand and community following already at such an early stage in that sense.
So talk us through, where you saw the opportunity, what you guys are delivering on right now, and how are you affecting people's lives?
Yeah. Be happy to. So during my time as the CEO of the F45 training portfolio that we had, I had the pleasure of working essentially with hundreds of individuals that were in a pursuit for a better level of well-being, right? And they were currently experiencing. And for the latter part of that career, I was also working predominantly with male professionals and executives in a high performance coaching capacity, so more productivity, health, and happiness. And also at the time for myself, I was doing everything right. I was training, I was recovering, my nutrition was dialed, it was on point, I was supplementing with all the right things, and yet something was still off, and I was 30 at the time. And so I just had zero energy whatsoever. And so I got my blood work done, and fair enough, my test was at 280, which is unbelievably low. And yet I was doing all the right things. And at the time, the tech wasn't where it is today.
You said 280 was what number was that?
That's what my testosterone level.
Oh, testosterone level. Okay, gotcha.
Yeah. Okay. And at the time, the tech wasn't where it is today. And so my only real option at the time that was presented to me was to jump straight on TRT. Right. And so that's where I really got to understand the deficiencies in the men's health market and the need for something different, essentially. And fast forward to 2023, we had those substantial advancements in AI, in genetic testing, in blood analysis. And because of COVID, as much as I hate to bring it up, more of a preventative approach to overall healthcare in general. And so essentially that was the perfect storm for this personalized health model to come to the market. And I looked at the telehealth model, which disrupted the way that we approach and think about getting checkups and prescriptions. And, you no longer had to go into a doctor's office to get and fulfill those prescriptions, right? We could do it from the comfort of our office or our own home. But the problem with that model is that at every touch point in the customer or the client journey, the client or the customer gets bottlenecked into a wait list, right? And so when I looked at the stats on men's health in the US, testosterone has been declining by 1% a year for the last 3 decades. Nearly 50% of men have a chronic disease. And heart disease is still a leading death for men. It kills 1 in 4 men in the US, and our suicide rates are 4 times that of women. And I looked at these stats, yet there's never been a better time to take control of our health with all the tech and the tools that we have available to us. And my theory on this is that we don't have a health crisis. We actually have an accountability and an ownership crisis, right? And going back to the telehealth model, where there is still so many friction points for men to actually use that model to then take ownership of their health. And that's why we built the Manly model the way that we did, right?
So you're basically doing telehealth where people could buy testosterone pellets on their own or pills after they do the blood work, or you do consulting like health consulting.
So what we did was, with the way that the model works, it has too many friction points to move the customer along the client journey to actually get them results. And I spoke to dozens of people that are in some of the top telehealth companies in the US, and they all had a very similar issue. And that was, from the time they got their blood work done to the time they actually had the practitioner phone call or consultation was up to about 90 days. And at that time, the blood work is redundant, right?
Yeah.
And so what I did is we built a phenomenal scientific team of nutritionists, neuroscientists, men's health experts, and naturopaths and data scientists to build a model that was going to automate that process using the advancements in AI that we've had, right?
Okay.
And so what we did was we surveyed 500 professional men to figure out what the top categories of male environmental health were that they prioritized over everything else. And we came up with focus, confidence, stamina, mood, sleep, libido, and recovery. So we built a really in-depth 86-question environmental health assessment to analyze those key pillars. And then we partnered with a third-party certified lab to provide a easy, convenient, at-home self-test solution. So it's a self-test dry blood spot solution. So you prick your finger, fill up 2 dual strips of blood, and send it back to our lab. And then our data science team built a complex recommender, which is an AI model, to then analyze 100 data points from the environmental health assessment and the biological health assessment and produce a really comprehensive health report, which is on a dashboard. So instead of a 42-page PDF, it's a dashboard, very interactive. You can see all of your stats very clearly, and there's no need to get it interpreted by a practitioner because it's very, very clear what your issues are and how they correlate to your overall health.
Gotcha. Okay.
So what we did essentially was remove the practitioner component and plugged in AI to fast track the time when someone signs up to be a customer to when they actually see their results to then when they get the results that they want from the protocols. And we fast tracked that by about 50%. So it's extremely fast.
And then from a step, keep going.
Sorry, the second part of the product or the service is a personalized health plan. So the AI uses the blood work data, it uses the environmental health data to then build a custom health plan with nutrition protocols based on your blood work. So consume more of specific foods and why, and then reduce consumption of specific foods and why, and then lifestyle protocols. So think biohacks for men. We'll actually recommend the top 3 to 5 interventions in the lowest scoring environmental health categories that are designed to improve your results over time. And then our main solution right now is a completely custom supplement formulation that we formulate and ship every month. So based on your blood work, our model will prescribe specific doses of specific micronutrients, aminos, herbs, extracts, and minerals into that custom supplement formula that comes in morning, noon, and night packs, and we ship it every month. And then every 90 days, we retest. And the beautiful part about this is it's a dynamic, it's an evergreen ecosystem based on the changes in your health. So when you retest, with all of the changes in your biology and your environmental health, all of the protocols actually change. So the formulations update, the health plan updates, and you can see the hard data plus or minus on every marker as well.
So let me ask you a question. So right now, I've been on a self-optimization, run over the last 90 days. I'm taking AG1. I'm taking 10 milligrams of creatine, and I'm
Yep.
taking a multivitamin, and I'm working out about 90 minutes a day, six to 7 days a week. What would your solution either eliminate or add to my routine? And I'm doing keto, by the way. I'm doing a keto diet
Yeah.
for the most part.
So in terms of the ingredients that would be attributed, it would be specific to your blood work,
Okay.
right? So it would replace your multivitamin,
Okay.
because the ingredients that we use have either clinical research or dozens of case studies on the impact they have on the specific markers that we test for.
Okay.
So depending on your thresholds of what those markers are is what ingredient will get attributed to that formulation as well. And look, we do at this point in time, it's 19 biomarkers because it is a self-test kit. So we don't currently do 100, but we're working towards stacking those labs in the future so we can get up to about 50 biomarkers. But we do some vitamins and minerals. We do liver kidney function, so ALT, AST, GFR. And then we do a hormone panel as well. And we do a cholesterol panel and a thyroid panel as well. So we give you a broad range of biomarkers to give you a really good baseline of your biological health. Because when you look at when you look at the marketplace, and I'll kind of going back to what I said about we have an ownership problem at this point in time. We have the tools that are available to us. Now the technology is there. It's 2025. AI is advanced. The blood work that we have advanced, and the tech is now able to make precise prescriptive logic based on your exact data. So if you're taking if we're just talking about supplements and you're taking a supplement off the shelf that is generic, a lot of them are really good products and they have really high quality ingredients. But because we're at a stage where you can get something custom built to your biology, why would you not use that option for basically the same price as
Yeah.
well?
So what would what's my startup cost or initiation cost, and what is my monthly recurring if I became a
Yeah.
member?
Yeah, so when you sign up, the first step is to do the blood work and the environmental health assessment. We charge $199 up front for the lab kit that gets shipped directly to your door. You take that, you send it back. We have a contract with the lab that once they receive the blood sample, they have to result it within 48 hours.
Okay.
Sometimes it's a little bit out of that window, but it is much faster than going to a phlebotomist. And then we charge $249 a month for the precision packs and the health plan access.
Gotcha. And that's drop shipped to me every 30 days. Here's your
That ships to your
to my
door every
dealer.
30 days.
Gotcha. And then do I have a coach, or is there a hotline? Is there an individual that I'm
Yeah.
talking to if I for whatever reasons I want to?
So we are, you're one of the first platforms I've spoken about this. So we are right now building out the Manly Concierge. So it's a hybrid product. It's a hybrid AI and human concierge service. So we have an LLM that actually is trained on millions of different bits of data when it comes to case studies and clinical research, but also is trained on your data specifically. So you can directly have conversations with the LLM, the large language model, about your specific data and about your plan so you can get real time feedback very fast. And then also we have the other component, which is the human access. So via a chat, you are able to access health coaching based on your data as well. Still trying to make sure that we do not become a telehealth company and we end up with those same bottlenecks or friction points as the rest of the marketplace. And that's why we are implementing that chat feature as well.
Gotcha. And obviously we do a lot of work in the med spa space. We're doing work now with companies that are in longevity and anti-aging.
Yeah.
So I'd say we're kind of just scratching the surface on people understanding what the potential is for themselves and what can be achieved. When you take a look and say, here's the results that you'll see in 90 days, 6 months, 12 months, how much of a runway or look back do you have right now with some of the people that have been on your program? Because obviously you just, you're a startup and, you need time, days to actually show results. So where are you guys at right now in the ability to do a look back?
Yeah. I mean, we have phenomenal data. We've got data on hundreds of different individuals that have been through the program. The average person stays for just under 6 months at this point in time as well. And for obviously a subscription product, that's definitely in the top, 0.1%. But before we launched the company, we ran a beta on 100 individuals. And those individuals we had a broad span of demographics. We had professional athletes, athletes, high rocks athletes, investors, entrepreneurs, professionals. And our goal with that was to essentially gather evidence-based data on the impact of the product, social credibility, and testimonials. And we ran that, and over a 90-day period, we actually collected some phenomenal results. And on average, across the board, just for one of the markers in like testosterone, we saw a 30% increase in test levels across the board. And that's an average. Some individuals it didn't move, and then other individuals, we had up to 58% change. And because they're not controlled studies, you don't have complete control over what the participants are doing outside of the product as well.
So we like to keep these to around 20, 25 minutes, get some bite size. So the last question I'll ask you is, if I'm doing research on this, I come across you, I come across a couple other groups that are, in and around what you're doing. Give me the pitch on why, partnering with MNLY or Luke, because you're kind of like the DNA behind this thing. And obviously you care. Obviously
Yeah.
you've like been your own kind of guinea pig to say like, hey, I'm gonna help myself. And as I like to say, and Dave hears me say this all the time, like the best way to create a new business is to find the frustration that you have,
100%.
solve the frustration, and then now scale that to other people. So what would be the reason to come to MNLY?
Yeah, great question. So for us, our differentiation factor is that we've created and productized men's health and automated it. So it's the most seamless possible experience when it comes to optimizing and taking control of your health. We can get you guys or anyone that comes into the program results in 50% less time than it takes with most of our competitors on the marketplace.
Gotcha.
And that's really it in a nutshell. It's seamless, it's on your own time, and you're able to take ownership and control of every stage of the process.
Awesome. All right. Well, we'll have all the information up here as this launches. People will be going into the fall and starting to get kids back to school and thinking about, what they can do to optimize themselves before hitting the holiday break. So I encourage you to take a look at MNLY. Love what you're doing. Obviously, we're trying to get more and more people to use the term acronym HALO and live a HALO lifestyle. So one of the best ways to do that is to make sure what you're putting in your mouth actually is beneficial to you. So thanks for supporting the cause here and devoting your life to it. So appreciate you. And I'll see you sometime when I get back to Manhattan Beach on a short visit, hopefully sometime in August, September.
Pleasure, mate. I appreciate you having me on.
Awesome. All right, man. Go HALO. Go MNLY. I like it.
Thank
Good
you.
stuff.